Hello my dear students. So today we are going to start introduction to community, right? So in introduction to community, we are going to discuss regarding what is community, what do you mean by public health, what do you mean by community health, what is community health nursing, what are the objectives of community health nursing, and what are the principles of community health nursing, right? Okay. Now, what do you mean by community? How you will define community? See, when a group of people, they're living together in a particular area, in a particular geographical area. For example, we can say like that they are living in a particular village, or we can say they are living in a particular town, right? So they have their common interests, they have their common values, common norms are there, right? So that is known as basically community. For example, we will say, see, in Gurugram, Haryana, there is one small village that is known as Farooq Nagar, right? So the people of Farooq Nagar, they are basically from Haryana state, right? So they share the common values, they have common interest. So the people who are living in that particular area in Farooq Nagar, they are known as community of Farooq Nagar. They are known as community, right? Next is, what do you mean by community health? Till now we have discussed what is community, till now we have discussed what is public health. Now what is community health? See, what is WHO? WHO is a World Health Organization, right? So according to them, public health includes, like, they basically define public health as a well-being of individual, right? Well-being means basically that includes everything. That includes person's environmental also, that includes person's social status also, that includes person's economic resources also, right? So that basically satisfy the person's needs, right? That is known as community health, right? Now, what is community health nursing? Right now, what is community health? See, community health nursing is an expertise. It's an expert's field, right? In this, we are focusing on a population. For example, if we will say, suppose Patodi is there in Gurugram, Haryana, Farooq Nagar is there in the Gurugram, Haryana. So we have to focus on all the population, all the individual, irrespective of their age, irrespective of their gender, irrespective of their caste, custom and religion. We have to take care of the whole population who comes under Farooq Nagar, or who comes under, we can say, Patodi, right? So that means we are promoting the health of the individual. We are preventing the diseases of a particular area, right? We are providing disability services to the individuals, to the community people, right? To the population. So that is known as community health nursing, right? Okay. Now, come to the objectives of community health nursing. See, the main objective of community health, the far most important objective of community health nursing is, we have to provide antenatal, intranatal and postnatal services to the mother. See, why? There is increase in the rate of maternal mortality rate, there is increase in the infant mortality rate, neonatal mortality rate in India. So to control all these things, it is requirement that we have to meet the basic needs of the individual. We have to provide a basic care, like expertise care to the mother during her antenatal period, during the intranatal and during the postnatal period, to reduce the infant mortality rate, to reduce the neonatal mortality rate, and to reduce the maternal mortality rate, right? Second thing, we have to educate the mother, we have to educate the family wherever we work, whether it's a village, whether it is town, or it's a country, wherever you work, you have to educate the family, you have to educate the community. We have to focus on the institutional deliveries, right? Avoid delivered from dyes or whatever the other sources are available in your community, right? You have to go to the hospital near to you, you have to go to the centers near to you, so that the services suppose if you require emergency services at that point of time, you will get that services, right? So that helps in reducing the maternal mortality rate and neonatal mortality rate, right? Now, another objective is concept of immunization. See, we have universal immunization program in which we have started many vaccinations for the babies. for the mother also during the antenatal period. For example, if we will say like TT, tetanus toxoid vaccination is there, right? So two doses we have to advise the mother to go for 2 doses for the TT vaccination in the nearby center or in the nearby hospital, right? So you have to encourage the mother, you have to encourage the family. These are the vaccinations, or we can say that this is the immunization schedule as per the government, right, authorities. So we have to we have to complete this immunization till the child is 5 years old, right? Now next is provide under 5 children care. See, we have under 5 clinics. Why we are focusing on under 5 clinics? Because infant mortality rate is very high in India, right? We have to deal with many issues during that period of time. Basically the population who are living in the villages, basically the population who are living in the rural areas, or we can say that poor areas, right? uh, Poor areas, they are not getting the benefits from the government, right? They don't know, they don't have any idea what is under 5 clinic, why the under 5 clinic is started by the government, what is the aim of starting under 5 clinics, why we are focusing on the infant. They don't have any idea. But during your home visiting, when you are go for the community posting, you are doing your visiting, so during that time you have to educate the mother. See, if there is some issue, avoid doing all these things, avoid doing all these things in the home, avoid home remedies, immediately go to the doctor, immediately go to a nearby center, and the services which are for you, which are provided by the government for you people, you go and utilize these services, right? So you have to provide under 5 under 5, or we can say that you have to provide expertise services to the families, or the families in the community who have under 5 children in their family, right? Now another important objective of community health nursing is health education. See, whenever we go for the postings, so whenever you interact with the people, whenever you interact with the family members, whether they are kids, or whether you're interacting with the old age people, or we can say that adolescents, lot of issues, lot of issues are there in the community. They, or we can say that they will share lot of issues, like somebody will say like, I'm having hypertension, so how I can focus on all these things. I'm obese, so how can I reduce my weight? So for that you should be ready for everything. You have to observe the things, like observe the things. For example, some, if person is very unhygienic, right, or we can say that when you are visiting the house and you will see like the environment is very poor in that particular house, right? So you have to provide incidental in teaching, or we can say that health education to the person, right? Immediately advise the person, do cleaning of your house, remove all these things from the particular area, from all these things, clean your area, clean your house. Or if person is obese, you can educate the person regarding the diet. This is your morning diet, this is your evening diet, this should be your dinner, right? Or if person is hypertensive, you can educate the person. These are the things that should be the part of your diet. These are the things you should avoid in your diet, right? So that is known as health education. So health education is a main aspect of community health nursing, right? Okay. Now next is, see, during your posting, during your community visit, when you will see like lot of health issues are also there, like communicable diseases are very common, or we can say that non-communicable diseases are very common in community, right? So you have to involve the community in providing services. For example, suppose we can say that during your visit you have seen there is one geriatric patient in the family, or we can say that geriatric person in the family, right? When person is diagnosed with Alzheimer disease, or person is having Alzheimer disease, see, in Alzheimer disease what happened, person didn't recognize anyone at some point of time. He doesn't know whether मैंने खाना खाया कि नहीं खाया. When you will ask him, आपने खाना खाया, he or she will say, I don't know, मैंने खाना खाया नहीं खाया, I don't have any idea, I didn't remember that what I had in dinner, what I had in lunch, what I had in breakfast. If you will say, who are you, what is your name, he or she may say you, मुझे नहीं पता, I don't know, पता नहीं मैं कहाँ रहता हूँ, मेरे को तो मेरा नाम ही नहीं पता. So this happens with Alzheimer, patients with Alzheimer disease, right? He or she didn't recognize his or her family member also. This is the main issue with the patient who is diagnosed with Alzheimer disease. And during your home visiting, you have seen that a family is there and that family is having a geriatric patient or geriatric person who is diagnosed with Alzheimer's disease. So at that point of time, you have to educate the family, you have to involve the family members in providing care to the individual. कैसे आपने इस geriatric patient की care करनी है, कैसे आप इसको recognize कराएंगे चीज़ें, right? So that person can live a happy life, right? Okay, another thing is, whenever we go to the community or whenever we learn things in the community, we always taught to you like that, like whatever the resources are available in the community, you have to utilize that services, right? For example, see, whenever you are posting in the hospital center, you have everything. You have you have different types of bags where you want to discard. You have yellow bag also, you have black bag also, you have red bag also. So easily you can utilize the services which are available in the hospital, right? But in the community, you have to utilize those services who are available in the community. For example, मैंने किसी को घर में जाके injection लगाया, so where I have to discard the particular things, right? So you should carry paper bags, you should carry some polythenes, black bags in your community bag, so that you can collect that waste material in particular bag, and whenever you will report to the primary health center or your sub center or community health center, you have to discard the things that after coming back from your community area, right? Okay, another thing is, see, during your visit, you have observed, like we have already discussed, like there are communicable diseases are there, we have like non-communicable diseases in the community, right? For example, COVID is there. For example, we will take example of COVID, which is very very common nowadays. So COVID is what? COVID, so most of the individuals, they don't care, they don't take care of all these things कि मुझे मास्क डाल के रखना है. They will say कहाँ है कोविड, कोविड तो है ही नहीं, मैं क्यों मास्क डालूं? No one is wearing mask in my community. किसी ने पटौदी में मास्क नहीं डाला. Why should I wear mask in community? I will not wear mask in community. मुझे थोड़ा ना कुछ कोविड है. No, you have to educate the person at that point of time. Say this is a disease, right? So this is a type of prevention. You have to prevent yourself from that particular thing, right? So if you are wearing masks, you have to educate other people in your community. This is the prevention aspect, and we have to do that, right? So this means you are involving the community in providing services, right? So involvement is must. Another thing, see, we have specialized services in your centers. We have sub centers, we have primary health centers, we have community health centers, right? So government is providing lot of services in the community. We have specialized services also. For example, we have started adolescent clinics. See, whenever the boys or girls, they reach at that stage, according to WHO, the age of adolescent is 10 to 19 years, right? So when boys or girls, they reach at that age between 10 to 19 years, lot of issues are there. So lot of changes occurs in their body. Sometimes they may feel, ये क्या हो रहा है मेरे साथ? This is something awkward with what happens to me, right? So the government have started adolescent clinics. So in adolescent clinics, doctors are available, the public health nurses are available, right? The community health officers are available. They basically deals with what? They basically interact with the adolescents. They educate them. These are the natural things, like this is not an awkward thing, this is a natural thing which happens with you, right? So that is specialized services started by the government for the community people, right? Another thing, see, whenever we will go in the community, so lot of things are there, lot of things comes in your mind. मैं इस पे भी रिसर्च कर सकती हूँ, मैं कोविड पे भी रिसर्च कर सकती हूँ, मैं इस पे भी रिसर्च कर सकती हूँ, मैं एड्स पे भी रिसर्च कर सकती हूँ, right? So the main objective of community health nursing is to conduct some researches in the community, so that we should have some fact in our hand, right? जैसे मैंने कहा, people, they have their perception, or we can say they develop, or we can say that they have developed the attitude, मैं क्यों मास्क डालूं, कोविड कहाँ है, कोविड तो है ही नहीं, कोविड का कोई केस तो है ही नहीं, why should I wear mask? So this is one topic where you can conduct some researches, right? So lot of things are there where you can go for the research, right? So these are the objectives of community health nursing. Next is, what are the principles of community health nursing? See, the basic principle of community health nursing is you have to meet the needs of the community. You have to plan the care as मीटिंग द नीड्स ऑफ द कम्युनिटी. ये नहीं मेरे मन में जो भी आया मैं कहूँगी अच्छा आज मैं इस पे हेल्थ एजुकेशन दूंगी, अच्छा आज मैं अनीमिया पे हेल्थ एजुकेशन दूंगी. नो, you have to, during your home visiting, you have to observe the community, you have to observe the family. For example, I have given 5 or 4 families to you, right? So you have to prepare the family folder. During your interaction, you have observed lot of issues are there in the family, right? So you have to plan the things, you have to plan the procedure, you have to plan the health education for meeting the person's need, for meeting the family needs, right? So this is the main principles of community health nursing. Another thing, the most important thing, whatever you will provide health, whatever health education you will provide to the community, किसी भी टॉपिक पे करें, आप अनीमिया पे करें, आप हाइपरटेंशन पे करें, आप डायबिटीज पे करें, आप हेल्थ एजुकेशन किसी पे भी दें, राइट? आवर मेन थिंग इज यू हैव टू गाइड द इंडिविजुअल, राइट? Community, you have to involve the community in providing services to the particular community. For example, I have already given example to you कि geriatric patient है family में, person is Alzheimer's disease. You have to educate the family कि how you will provide care to that particular individual. आप उस बुजुर्ग की कैसे केयर कर सकते हैं, आप उस geriatric patient की कैसे केयर कर सकते हैं. That means you are involving the family members to provide care to a particular that particular people, right? That particular geriatric person. Or we can say that you are guiding the person how you can provide care to the patient, right? This is the main concept of community health nursing, right? Another thing, whatever the health services you will provide to the community, that should be real, that should be realistic, right? And you have to utilize the community resources only. ये नहीं मैं कह दूं अच्छा यहाँ नहीं है तो आप बाहर किसी हॉस्पिटल में चले जाइए, यहाँ नहीं है तो वहाँ चले जाइए. No, the services which are available in your center, in your nearby center, you have to utilize that services. You have to educate the community. These are the services provided by the community health center near to you. Go and utilize that services, right? So you have to educate them for that. Okay. Another thing is, always remember that community is a unit of healthcare services. Community is what? It is a unit of healthcare services, right? We have some referral system, sub-center, then PHC, then CHC, then district health center, then district to that super specialty hospital, right? So healthcare services, it's a community, the part of community health nursing is healthcare services, right? Another thing, see, there should be some professional etiquettes. You have to remember that. You have to develop a professional relationship with the individual, right? ये नहीं कि मैं उसकी फैमिली में इतना इन्वॉल्व हो जाऊंगी कि मुझे उसका दुख भी अपना दुख लगे. No, it should not be like that. Yes, you have to be there to sort out the issues of the family. ये नहीं कि मैं यही भूल जाऊंगी कि मैं एक कम्युनिटी हेल्थ एक्सपर्टीज पर्सन हूँ और मुझे इसको सर्विसेज प्रोवाइड करनी है, मैं उसके दुख में मैं भी रोना शुरू कर दूंगी. नो, इट शुड नॉट बी लाइक दैट, राइट? Whatever issues are there, whatever things are there, you are there to sort out the family's issues, you are there to sort out the person's issues, right? So you have to be, there should be, you have to develop a professional relationship with the family, professional relationship with the community, right? Another thing, whenever you go for any type of research, whenever you go for collecting the data for any type of like any type of research, मैं कहूँ मुझे hypertension पे करना है, मुझे AIDS पे research करना है, मुझे COVID पे research करना है, you have to, you have to inform to your participants or your sample that I will never disclose your information to others. I have to maintain the confidentiality, right? Only then the people will be, able to interact with you. The people will, love to work with you. People will shows interest in your research, right? So some dignity, you have to maintain dignity, right? Okay. Now, another principle of community health nursing is like whatever the decisions you will take in the community, you have to involve the community, right? Whatever you will do, you have to involve the community. And the health services that must be continuous. ये नहीं कि मैंने एंटीनेटल मदर को पहले एजुकेट कर दिया, दिस इज द प्राइमरी हेल्थ सेंटर, डॉक्टर इज अवेलेबल, आप जाइए जाके डॉक्टर को दिखाइए. नो, यू हैव टू डू द फॉलो अप विद द फैमिली, विद द एंटीनेटल मदर. चेकअप के लिए गए कि नहीं गए, डिड यू वैक्सीनेट योर सेल्फ फॉर टीटी, कितनी डोज लगी आपको, कब लगी आपको, मुझे अपना कार्ड दिखाइए, कहाँ पे आप डिलीवरी करा रहे हैं. सो हेल्थ सर्विसेज शुड बी कंटिन्यूअस, राइट. ये नहीं कि मैंने 2 दिन विजिट किया और मैं उसके बाद एंटीनेटल मदर के पास गई नहीं, कि आप कब गए और कब नहीं गए, राइट. अनदर थिंग, द हेल्थ सर्विसेज शुड बी प्रोवाइडेड टू द इंडिविजुअल्स, irrespective to all the individuals, irrespective of person's age, irrespective of person's caste, irrespective of person's religion. ये नहीं कि this person belongs to some other religion तो मैं इसको health services नहीं provide करूँगी, और ये बहुत poor family से belong करता है, this person is from BPL family, इसके पास BPL card है, मैं इसको service provide नहीं करूँगी. No, you have to provide health services to the individual irrespective of person's age, gender, caste, religion, चाहे वो जितना मर्जी पुअर फैमिली का ना हो. So you have to provide services to the individual, right? So the health services which are provided to the individual, that should be at we can say that it should be available without any difference, right? Another thing, after providing services to the individual, you should know how to evaluate your things, right? For example, I have visited I have visited the Farooq Nagar, right? Farooq Nagar mein I have seen like people, they don't want to wear the mask ही नहीं डालते, वो कहते हैं कहाँ है कोविड तो है ही नहीं. But after 15 days, what I have observed, like people have started wearing mask. After giving my health educations, I have given so many lot of educations to the individuals. मैंने families में जाके health education दिया, मैंने ग्रुप बना के हेल्थ एजुकेशन दिया, राइट. मैंने एक जगह पंचायत में लोगों को इकट्ठा करके हेल्थ एजुकेशन दिया, लाइक व्हाई मास्क, वेयरिंग ऑफ मास्क इज इंपॉर्टेंट एंड हाउ टू वेयर मास्क. एंड आफ्टर 15 days आई हैव ऑब्जर्व दैट अराउंड, सपोज अगर मैं कहूँ कि वहाँ पे 4000 पॉपुलेशन है, सपोज फॉर एग्जाम्पल 4000 पीपल रहते हैं, राइट. उसमें से 3000 लोगों ने मास्क डालना शुरू भी कर दिया है. सो दिस इज द टाइम टू वैल्यूएट माई थिंग्स, कि मैंने अगर एजुकेशन दिया तो मेरी हेल्थ सर्विसेज का लोगों ने कितना बेनिफिट उठाया और कितना उनको मीन्स इन्फ्लुएंस हुए उस चीज़ों की तरफ, राइट. सो दैट इज नोन एज प्रॉपर इवैल्यूएशन ऑफ योर सर्विसेज. अनदर थिंग, whatever you will do in the family, मैं कहूँ मैं एंटीनेटल हाइट लेती हूँ फैमिलीज में जाके, आई गो एंड डू एंटीनेटल वेट एवरी टाइम, मैं न्यू बॉर्न असेसमेंट करती हूँ, मैं बेबी का हेड सर्कमफ्रेंस लेती हूँ, चेस्ट सर्कमफ्रेंस लेती हूँ, वट एवर यू विल डू इन योर फैमिली, you have to maintain proper record for that, right? You have to maintain your diary, you have to maintain proper things with you, like this is the house number, I have visited this house number, one antenatal mother was there in the family, she's primary gravid or whatever it is, right? And she's in her second trimester, and I have educated her to go for this institutional deliveries. So this is the doctor, you have to go there and meet there. I accompany her in the primary health center, and she took 2 TT with TTT, TTT in the primary health center. You have to maintain each and everything in your record book. Another thing, anything, if you feel anything is something awkward in the community, you have to report immediately to the medical officer, whosoever is in charge in that particular center, right? You have to report him or her, like this is the thing what I have observed in the community, so we have to take care of this thing. For example, during my home visiting, I have observed that there is one place, like बहुत सारा पानी है वहाँ पे, बहुत गंदा पानी है, आसपास घर बने हुए हैं, राइट, और वहाँ पे बहुत सारे मच्छर हैं और लोगों को कोई फर्क नहीं पड़ रहा है, दे डिडंट बॉदर कि वहाँ पानी है, क्या हो रहा है. सो इमीडिएटली यू हैव टू रिपोर्ट टू द मेडिकल ऑफिसर, like this is the thing in that particular community, so there are chances of malaria, chances of dengue are there in that particular community, in that particular street, or in the particular sector. So immediately you have to take some strict action against that, so that we can control on that particular things, right? So recording and reporting is must as a community health person, as expertise in community health, right? Yeah. Thank you so much. This is all about my today's lecture. So thanks for watching today's session. For more learning or community health, please like, share, subscribe the channel. I will keep on sharing the lectures with you on community health. Thank you.